York Times very closely. So when I was teaching you, I believe it was Friday. I forget what day it was, maybe Tuesday. Well, I guess it's here. On February 27th, so who knows when that was, the New York Times had an article that popped up on my phone. Anything health related, I'm going to pop up on my phone because it's always going to be an episode for you to learn, no doubt. They did an investigation. UNOS. What does UNOS stand for? Universal. I even wrote it down so the babies would know. It's universal. No, what did I do with it? I gotta find it because I want you to know that language. I don't want you to be goofy like me.
You said New York Times and CNN is a good source.
Yeah, CNN for alerts. They're not exactly not biased.
I should stay off the shade room and say cheese TV.
What the fuck did you just say? You said what?
You know, I just be bothered.
Oh, no, that don't none of that sound right. Okay, so UNOS, I wrote it down for you guys. UNOS is United Network for Organ Sharing. I don't care that you know this, but I can see your test spelling it all the way out. Can't you? So United Network for Organ Sharing. What if they spell it out? We want to know what it is, right? This is the organization, you know, with the whole organ procurement. And they're not going to say organ donation, are they? They're going to say organ procurement. Remember that word? I told you that was on the test. Okay, so here we go. They did an investigation because they got a tip that was reported to them. And they thought they would look into it because you don't know till you investigate, right? Now, just to put a little bit of perspective on the New York Times, how long has the New York Times been around? Forever. A long time. Who was the ones who discovered the Tuskegee experiment? The New York Times. New York Times. So remember when that started? That Tuskegee experiment with looking at syphilis progression in black males in Tuskegee, Alabama, that started in 1927 and it went all the way to 1977.
Not that long ago.
Not that long ago. And it would have continued if the New York Times didn't discover it. Okay, so that's why it's always a great reputable place to start. Now, they did an investigation. Here's how it's supposed to go. I like this because it showed you exactly how it was supposed to go. As a matter of fact, I couldn't have wrote it any better. Look at how it's supposed to go. The sickest patient has priority. You saw that, didn't you? Because that's why Izzy crazy ass was lying. If there's nothing like the sickest patient, the waiting list is appropriate. You saw that with the 17-second rule. I mean, it was perfect. That is supposed to be the way it is. However, the New York Times found in 20% of the transplants that have occurred, that list was ignored. We don't like that. Now the hard question for you. You learned ethical principles, a lot of you have, this past weekend. Which ethical principle did this violate? Which one of them fancy words? You think it's beneficence? Anybody else have another guess?
Justice.
You think it's justice? Anybody else?
Non-maleficence.
Non-maleficence. Anybody else? Nothing? Going once. Going twice.
Justice.
Someone else said justice. Anybody else? Okay, we got what? 4, right? We got 4 on, no, we got 3 on the table. Raise your hand if you think it's justice. Raise your hand high, don't be a punk. Now the person that said it should have their fucking hand up. Hello. 1, 2, 3, 4, 5. 5, right? Raise your hand if you think it's beneficence, violating the principle of beneficence. 1, 2, 3. Okay. Raise your hand if you think it's violating the principle of non-maleficence. 1, 2, 3, 4, 5. Raise your hand if you were a punk and didn't vote. Okay, so we're going to start this over. This your time. I already been paid. Because nobody can be a punk and not vote. All right, let's do it again. Raise your hand if you think it's a violation of the ethical principle of justice. 1, 2, 3, 4, 5. Raise your hand if you think it's a violation of the principle of beneficence. 1, 2, 3, 4, 5. Raise your hand if you think it's a violation of the ethical principle of non-maleficence. 1, 2, 3, 4, 5, 6. I'm waiting.
I didn't hear the question, so I didn't raise my hand.
Okay, just raise your hand so I can count. Thank you. 7. I mean, I'm looking at y'all. Y'all gotta vote. Okay, so here we go. We have the 3 on the board. I'm gonna put them there. Take out your management of care, because you're going to tell me which one of these are true. And if you don't have it, I'm going to come around with it. And it's going to be under the title Ethical Principles, so look under your E's. Look under the E's and your management of care. Ethics, yeah. Very good. Who else needs a management of care? Only quite a few of you do. So look under your E's. Anybody else needs a management of care? What color is it?
Pink.
Uh-oh, it's pink. Ooh-wee. So you got your management of care. You're looking under the E's for your ethical principles. You're looking under the different definitions. And you're going to tell me which one did you come up with.
Justice.
Yes. Excellent. So who said that? Raise your 5 hands. Excellent. There you go, y'all. Okay, so this is a violation of the ethical principle of justice. Justice assures fairness, especially with things like organ donation. Hello.
You answered it. I was going to ask the question, why is it that, but you answered it already.
You said what, baby?
I was going to ask, why is it justice, but you answered it already.
Well, look at what it says.
I read why. but you
Read it
answered
out loud.
Especially with scarce resources, i.e., which is example, organ procurement, sliding scale, and fees for services.
But what it said at the beginning of it? You just read the end of it.
Especially with scarce resources.
No, it doesn't
Fairness.
start. Fairness. There it is. Okay, so I didn't say anything different than what you read. Okay, so here's what I'm saying to the babies. You have an investigation done by a reputable source, not some extremist organization. It's telling you that 20% of the transplants, they just ignored the fucking list. Like they didn't give a fuck. Now let's see an actual case study. The report that they got that told them maybe they should look into it is that Marcus was an African-American teenager in Michigan. He was next in line for a transplant. His doctor let him know. And the person that ended up getting it was number 3,558 on the list. Okay. Now watch this. Watch this, guys. The investigation found that over the last 5 years, 1,200 deaths that occurred were actually next on the list. Now, they may not have been medically adequate, but how the fuck would they know? They never got a chance to find out. Who got the organs? Usually white, male, college grad, or Asian, creating a widening disparities in healthcare. So when you hear me talk about disparities in healthcare, you now have another example. Now, this right here, all this is pertinent to me because you may not know, but you have a classmate that's been waiting on a kidney forever. Share with them.
I think I've been on the kidney transplant list since the end of 2022. It was like October,
Yeah.
November of 2022.
And how did all of this happen? How old were you when you found out what you had, needed a kidney?
I got diagnosed with lupus when I was turning 21. So
What were your symptoms?
everything on me would just like swell up. Like my joints would swell really bad.
So swelling,
It would
joints
be hard for me
hurting.
to walk. I would get rashes on my face.
Yeah, the little circular rashes.
Yeah. But it was really the joint swelling was like the really bad thing. Then I lost like a lot of weight. I was like super skinny.
Okay.
Then I went to the doctor, and my primary care provider referred me to a nephrologist because she had a thought it might be lupus.
Okay.
But lupus is really hard to diagnose.
Yes, it is.
So-
There's no, and that's on your test. There's no one test for lupus. There is no one test for lupus.
So they gave me a kidney biopsy, and
Did that hurt?
No.
And what position were you in? Were you on your tummy or your back?
yeah, I was laying flat on my tummy.
That's on your test. You are prone for a kidney biopsy because they're going to go back here. Okay.
And then by that time, I was already in stage 3 of chronic kidney disease.
Wow.
So
What were your symptoms with that? Just swelling, right? Was your blood pressure elevated out of curiosity?
I don't remember. I don't think so.
Yeah, they would have mentioned it.
Yeah,
Okay.
I don't remember. It was really just like my joints. That was like the
The biggest thing. And they hurt.
Yeah.
It was
really
difficult to walk.
bad. Yeah,
Okay.
like super bad.
Okay.
And then by that time I was in chronic kidney disease stage 3.
Okay.
And so after that, I got put on a lot of medications, and I was 21, so it was kind of like, I feel like I wasn't probably taking the best care of myself.
No one does it, 21.
Yeah. So it was like a big adjustment or whatever, but my kidneys started to crash really fast after that,
Yeah.
and I went into end-stage renal failure.
How old were you then?
I was 23.
Okay.
23, I think. Yeah. And after that, they said that my kidneys were functioning. I was at like 19%.
That's very important because what she's talking about is the GFR, the glomerular filtration rate. You get on that list at 20. You kind of want to know that. You qualify for the UNOS list when your GFR is 20. Because my dad called me when he was 19 and I was flabbergasted. Tried to give him a kidney, wouldn't take it and all that. Okay.
So I was, I had graduated college by this point, but I went back to school to the accelerated nursing program.
Ah,
And
what
then-
was your first degree in?
Health sciences.
Okay, so perfect.
Nursing.
Perfect slide on into nursing.
Yeah.
Okay.
So then, I think it was like literally like 4 months or something. My kidneys really started to crash, and then I was at like 5%.
Oh,
Like-
no.
Yeah, so both of my kidneys function total at 5%.
Yeah.
So then I got put on dialysis. My doctor chose peritoneal dialysis because it was more flexible
Convenient.
with my schedule.
Yeah. What did you think of that, just as a young lady and a nurse?
Being on dialysis, it takes away like a lot of your freedom.
Exactly.
And people who know me know like I'm pretty social. I'm pretty social, so like I do a lot of things. So it kind of makes it hard for me to like have to adjust my schedule around my dialysis. So I have to do dialysis every night for 10 hours.
Every night for 10
hours. If you choose peritoneal, which my dad chose at first too, because I was too frightened for him to go to a center for dialysis, thinking, what if they're not clean and they give my dad hepatitis? So I was like, Dad, let's just try peritoneal. And then, so he did the peritoneal, and it's just like you say, it's 10 hours at night, every single night. You don't get away without doing peritoneal every day. Yeah.
So.
Were you living alone or with your parents the whole time?
Oh, I live with my parents, thank God.
Thank God, because you're not allowed to live alone.
Yeah.
And that's what I want you to remember. You have to have someone who will sign that they will be there for you to do it if you can't on your test.
Yeah, so when I got, when they told me I had to get on dialysis, I had to get my PD catheter placed in my stomach.
How did that feel?
That actually hurt, afterwards, because, you had to get adjusted to it, and then the scar tissue has to build up and stuff.
Just like a shunt.
Yeah. And so then, about 5 months later, I think that's when I started my training for the dialysis. Me and my dad had to do it because it has to be like a second in command if something happens.
Yes, they have to sign a contract that they agree to be your second in command.
Yeah. So me and my dad are certified with that.
I could tell you're daddy's girl.
Yeah.
I met her parents at the hospital and everything.
Yeah. So, yep.
Now, how do you do it now? You're still on your peritoneal.
Yeah, I still do my peritoneal. Oh, this is what I probably should say. I was supposed to get a kidney transplant January of 2024, but
we were all excited.
Yeah, but the girl, she backed out 3 days before the surgery.
Why?
So, she never really gave me an answer, but I think she was honestly just scared.
Yeah, 3 days before.
It's a big surgery.
We were all so hopeful because when you are going through, and I told you this over the weekend, that I have people in here that go through chemo, people waiting on organs, people immunosuppressed. I've had people in here that just had bariatric surgery, people with twins in their belly. I mean, we have everything in this class, and that's why we're very strict about the whole, don't come in here all sick because you're going to make my baby sick. And, if you, back in the days of COVID, you couldn't even come to my class unless you'd been vaccinated because of situations like this. But if you are that student in my class that is undergoing such turmoil and just horrible trials and tribulations, what we do is we give you unlimited access, right? So it means there's no due date on your class. As long as it takes us to get your license, that's how long you're going to be in my class. There's nothing you need to pay. There's nothing you need to do. That's just the way it is. You're going to be here until you pass this test. There will be no repeat payments after that first payment and extension. So what we know is we've been through these freaking roller coaster rides with Nakaya, and it's very, very, very what the fuck? She didn't want to give you a kidney? Oh my God. We mad. We ready to jump her like a project chick. But you can't do that because obviously she's an individual as well. And it is a lot. It's a lot to give someone a kidney. It is major surgery. Of course, you'll heal up and do well, but she just chickened out. Do you see that? So we've been waiting how long for this kidney now, if we count?
This is the 3rd year, I think.
3rd year. So how do you know what's going on with your list? How does this play out? You went to Michigan, or no? Yeah, you did go to Michigan.
Yeah. So from a patient perspective, it doesn't seem like there's a sense of urgency in regards to being on the list. So it's kind of knowing the nursing perspective and the patient perspective, I can see why there's so many people on the list, because it just doesn't feel like
nobody cares.
Yeah. So they have suggested that the more lists you get on, the better your
That's what you said. Yes.
So that's why I'm listed at Cleveland Clinic right now, and I'm listed at Michigan and
Ohio
Toledo.
State. Oh, Toledo.
Yeah,
Have you
Ohio
thought of?
State didn't accept my insurance.
Oh my God. So it's about insurance again, huh?
Yeah.
What the fuck? Okay. So can you see the little wheels turning in your mind and your spirit so that you are more realistic about what's really happening with people waiting on a kidney, a liver, or a heart? That was all three of these, by the way. This was kidney, livers, and hearts for this investigation that they did. But I thought that would be very illuminating. So I talked to Nakaya before class and asked if she would mind sharing some of her turmoil and trials and tribulations with this process.
Also, for like the kidney, you have to do a lot of testing, like workup for
Yes.
yearly exams.
Yes.
Every year, I have to do basically an exam on every part of my body, like just ensuring
An
that
exam on every part of your body.
basically
Blood work, the whole nine.
every system, basically.
Yeah, if you're like my patients, I draw like up to 20 to 30 tubes of blood on
Yeah.
them when they're ready for it. Yeah.
The last one I said, okay, I'm feeling a little lightheaded.
You
now.
think?
You taking all the blood?
And you don't even have a port that I could draw it from.
Yeah.
So that would be crazy. I would not even draw you unless you were in a wheelchair, and I wouldn't finish drawing you unless I had somebody with you to take you out of the
And you
wheelchair.
speak to everybody on every part of the team. Like the last appointment I had spoke with the surgeon, the kidney surgeon.
Okay.
And he was like, we were about to give you this kidney, but another guy qualified for it. I was like,
Don't even tell me no shit like that.
I said thanks.
Yeah, like
Oh, thank
keep
you.
that to yourself,
Yeah.
motherfucker.
You really could have kept that to yourself.
Yeah, you should've.
He should have kept that to himself.
Yeah.
One of the other things I wanted to tell you is, and Nakaya experienced this, what type of precautions are we supposed to give the patient that is up for transplant and preparing? Neutropenic. So she had a hospitalization not that long ago. We were all up there trying to help her out. What was that about? It was preparing for a transplant. She was on CellCep, I think, or one of them damn transplant drugs that make your immunosuppressed in case you get a kidney. And it gave her an infection.
It was
So,
bad.
it
I
was
thought I was about to go to the
life-threatening. Yeah, the upper room of
It was bad.
a little bit of heaven for you, upper room. Yes, that's what they took her call like.
Yes.
That's illegal.
It is illegal.
So many levels, that's so long.
But
Yeah.
I had CMV.
Yeah, cytomegalovirus. So in case you think, all this is just textbook, if you look on page 10 and you look in your Oh My God packet and you look up neutropenic precautions, you will see the CMV, which is always in children, but deadly in immunosuppressed. And she was really, really sick.
Yeah, I
Okay.
was about to go into septic shock.
Yes, you were. Yes. It was no joke, man. I'm telling you guys, it was bad. And I went up there and I had to talk to one of your nurses, but I don't remember why I had to fuss.
Oh, the unit I was on was just like really bad. They weren't.
Was it the IV that wasn't right?
It was a lot of things.
It was a lot. So I had to fuss a little bit and they got it
But
together.
once
But
they saw Miss Shelley, they got their act together.
yeah, they were like, oh, Michelle's on the floor. She's on our floor.
They literally got their. I said, "Oh, you guys are being really nice and attentive now."
Instead of stealing your call light.
Yeah.
So I want you to know that you don't know the struggle of the person sitting next to you. That's why we say we're all cousins, because we're in it together. And then when you get out of here and you see each other, you will be amazed and excited because you know that they know as much as you do. And you pretty much found out from the day you started your new job that everybody else is pretty dumb as dirt. Okay, so that's that. Now, the actual case study is very much like this, but it's not an LVAD. So we're going to do our case study. And this case study is, it says case study boot camp, just that means that that's what we did. So I'm going to let